Welcome to the deep dive. Today we're looking into something quite a few cat owners might encounter. Feline Symmetrical Alopecia.
Yeah, it sounds a bit technical, doesn't it?
It does. But it essentially means cats losing hair in, well, matching patterns on their body.
Right, on both sides. And often, the skin underneath looks, surprisingly okay at first
And
glance.
that simple look, these matching bald spots, it's actually a clue, isn't it? Signals something else is going on.
Exactly. It prompts a deeper investigation. Our guide for this is the paper Feline Symmetrical Alopecia, Diagnosis and Treatment.
Great. So our goal today is really to unpack the potential causes, understand how vets diagnose it, and get a handle on the treatments.
We want to give you, the listener, a clearer picture, especially if you're maybe seeing this with your own cat.
Okay, let's start with the basics then. Based on the source, what defines this condition?
No, alopecia just means hair loss.
Yeah.
Symmetrical means that matching pattern, left and right. And the key part is no gross changes in the skin, initially anyway. So no obvious redness, scabs, that sort of thing right away.
And it's not really a disease itself.
No, not really. Think of it more as a signpost. It points towards some other underlying problem, internal or maybe external.
And the amount of hair loss can vary. I think the source mentioned that.
Yeah, it can range from like almost total baldness in those areas to just thinning hair. And while we say symmetrical,
It's not always perfect.
right, exactly. Sometimes it might look a bit patchy, not quite a mirror image.
Where do we usually see it? The source points out some common areas.
The classic spots are the belly, the ventrum, and the lower back near the tail, the caudal dorsum,
Okay.
and also the back and sides of the thighs. But it also mentions you might see some unsymmetrical loss, maybe on the legs or paws sometimes too.
Interesting. So it's a pattern to watch for, even if it varies a bit.
Yeah.
Right, let's get into the why. What could be causing this? It sounds like quite a list.
Oh, absolutely. The source helpfully breaks it down into categories.
Yeah.
A really big one is hypersensitivity.
Allergies, basically.
Yeah, exactly. Things like flea allergic dermatitis, super common cause of itching and over-grooming.
Right.
Food allergies too, and atopy, which is like environmental allergies, pollens, dust mites,
So the cat's itchy from the allergy, licks itself too much, and the hair comes out.
Precisely. That over-grooming is often the direct cause of the hair loss you see. Then there are ectoparasites,
Fleas again?
fleas definitely, but also others. Shalealosis people call it walking dandruff.
Oh, right.
And even ear mites, Otodectes sanotis. Sometimes the itching from ear mites can make a cat itchy elsewhere too.
Huh. Would have thought of ear mites causing body hair loss. Okay, what else?
Infection is another one. Specifically, the source mentions dermatophytosis.
Ringworm.
That's the one.
Yep. Okay, so allergies, parasites, ringworm. What about internal stuff or behavior?
Well, the source does mention neurologic or behavioral factors like psychogenic alopecia.
Stress licking.
Kind of, yeah. But it emphasizes this is actually uncommon as the primary cause. It's often secondary to itching.
Ah, okay. So less common than we might think.
Definitely. Then there's stress or metabolic changes causing something called telogen effluvium.
Telogen effluvium, what's that?
It's basically when a lot of hair follicles kind of jump into the resting phase all at once due to stress or illness and then shed.
So a big shed triggered by something systemic. Makes sense.
So,
Are there more serious possibilities?
unfortunately, yes. The source lists neoplasia cancer, specifically a rare thing called paraneoplastic alopecia linked to pancreatic tumors.
Wow, okay. That's serious.
It is, though, thankfully rare. Hormonal issues are also possible, like hyperadrenocorticism, which is Cushing's disease, or hyperthyroidism.
Overactive thyroid.
Yeah, and interestingly, the source notes that alopecia, the hair loss, can sometimes be an early sign of hyperthyroidism in cats.
Good to know. Anything else?
Lastly, immune-mediated causes like alopecia areata are mentioned, but again, noted as rare in cats.
Okay, that is a huge range of potential causes. Flea bites to allergies to hormones to, well, even cancer. No wonder diagnosis is key.
Absolutely. It's all about differential diagnosis, ruling possibilities in or out systematically.
So how does a vet start that process?
Often starts with basic lab tests, CBC, biochemistry profile, maybe a urinalysis.
What can those tell you?
Sometimes they give clues. Like the source mentions eosinophilia, high levels of a certain white blood cell can show up in some allergic cats.
A hint towards allergies.
Exactly. And checking the serum thyroxine level is crucial for ruling out hyperthyroidism. Imaging, like x-rays, usually isn't relevant for the alopecia itself, though.
Right, so blood tests give pointers, but you need more hands-on checks.
Definitely. A simple but vital step is thorough flea combing. looking for fleas or flea dirt.
Gotta rule out the obvious first.
You got it. Then looking at the hairs themselves under a microscope is really insightful.
How so?
If the cat's been licking or chewing them off, the hair shafts will look broken, blunt-ended. But if the hair is just falling out on its own, like intelligent effluvium or maybe a hormonal issue, the ends will be tapered, natural telogen hairs.
That's clever. Just the shape of the hair end tells the story.
It really does. Then a fecal exam can sometimes show if the cat's swallowing a lot of hair from grooming.
Or find parasites.
Or find parasite evidence, yeah. Like Shaleatiella mites or even tapeworm segments, which come from fleas.
Okay. What about allergies? Diet trials.
A food elimination diet trial is absolutely critical if you suspect a food allergy. It's kind of the gold standard.
And for environmental allergies.
Intradermal tests, like the skin prick tests in people, can help diagnose atopy.
When does the vet need to look deeper, like at the skin tissue itself?
A skin biopsy is often really helpful, sometimes necessary for a definitive diagnosis.
Taking a tiny skin sample.
Exactly. A pathologist looks at it under the microscope. It can show inflammation patterns typical of allergies or rule out other skin diseases or point towards those rarer systemic issues. And if there are any little bumps or crusts, cytology looking at cells wiped from the surface might show lots of eosinophils, again hinting at allergies.
And skin scrapings.
Hair plucks.
Yep, skin scrapings look for mites like Demodex, and hair plucks can be checked for ringworm spores or Demodex too. It's a thorough process.
Definitely sounds like detective work. So what does the pathologist actually see in those biopsy samples?
Well, it totally depends on the underlying cause, of course.
Right.
But for example, in true Psychogenic alopecia, the interesting thing is the skin and hair follicles often look completely normal.
Which supports the behavioral idea.
Exactly. But if it's allergic dermatitis, the biopsy will likely show inflammatory cells, maybe lots of mast cells, eosinophils, lymphocytes, depending on the type and chronicity of the reaction.
Different cells for different reactions.
Yeah, the pattern gives clues. And for that rare alopecia areata, they'd see lymphocytes specifically attacking the bottom part of the hair follicles.
Fascinating details. So once they have a diagnosis, or at least a likely cause, how is it treated? The absolute key, as the source stresses, is treating the underlying cause. You can't just treat the hair loss itself.
Makes sense. Address the root problem.
And good communication with the owner is vital. Explaining the process, the potential causes, and that, hair regrowth can take time.
Setting expectations. What about medications? Are there meds just for the symptoms?
Sometimes meds are used to manage symptoms like itching while the diagnosis is ongoing or as part of the long-term plan. Antihistamines like chlorpheniramine might help some cats with itch.
Okay.
Glucocorticosteroids like prednisolone are potent anti-inflammatories and stop itching quickly.
But they have downsides, right?
They do. Potential side effects like increased drinking, urination, appetite, weight gain. And ironically, steroids themselves can sometimes cause skin thinning and hair loss.
Oh, wow.
And crucially, they suppress the itch, which can mask signs needed for diagnosis, especially for allergy testing or food trials. You have to be careful with them.
Right, so use them strategically. Any other options?
The source mentions amitriptyline and clomipramine, which are sometimes used for behavioral components.
For the anxiety or compulsive grooming?
Potentially, yes. And cyclosporine atopica is a common brand, is an option for managing diagnosed allergic skin disease.
Okay. And you mentioned stopping meds for tests.
Yes, a really critical point the source makes is stopping anti-itch meds, especially steroids, before doing things like food trials or allergy testing because they can totally skew the results.
Got it. Very important detail. What's the general outlook?
Frequent follow-ups are usually needed to confirm things and see how treatment is working, but the prognosis is generally best if you can identify and successfully manage the underlying cause.
Like controlling fleas or finding the right hypoallergenic diet.
Exactly. If you can get the primary trigger under control, the hair often has a good chance of regrowing, though it can take a while.
Okay, so let's wrap this up. What seems like simple, symmetrical hair loss in a cat? It's really not that simple at all, is it?
Not at all. It's a visible clue that kicks off this whole diagnostic journey for the vet.
A real detective case, considering the range from allergies and parasites to hormones or, rarely, even more serious diseases.
Precisely. It's a reminder that the skin and coat can reflect so much about a cat's overall health.
And hopefully, understanding these steps, the potential causes, the diagnostic tests, the treatments, gives you a much better feel for how vets approach this common feline puzzle.
It really should. And maybe it leaves us with a final thought to consider.
Go on.
Well, seeing how many different things, internal and external, can show up as just hair loss in a cat,
Yeah.
it makes you wonder, doesn't it? What other seemingly surface-level symptoms, maybe in our pets or even ourselves, might actually be signals of something deeper or more complex going on underneath?